Hi, welcome to the Nurse Coach Duo. This week, we're interviewing Dr. Kendall Lynch, a doctor of physical therapy and the founder of Niche Specialized Physical Therapy in Oak Park, Illinois. Kendall earned her degree from Duquesne University and completed a prestigious fellowship in dance medicine at Columbia University Irving Medical Center and Westside Dance Physical Therapy, where she worked with the New York City Ballet and American Ballet Theater dancers. In addition to being board certified in orthopedics and certified in Pilates-based rehabilitation, Kendall furthered her career, her education through Herman and Wallace, focusing on women's health and pelvic health. Kendall combines orthopedic expertise, pelvic health training, and dance medicine to help clients of all ages recover from injury, enhance performance, and prevent further issues, allowing them to move freely and perform their best. In this episode, Dr. Lynch breaks down how movement and strength training protect our joints, boost bone density, and ease the aches that often keep women from exercising. As a movement expert, Kendall reminds us that pain is a message, not a stop sign, and that multidirectional progressive movement is key to keeping the body strong and resilient. Her shirt and her voice remind us to be strong, be different, and be empowered. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider. Hi, welcome to the Nurse Coach Duo. I'm Coach Jen, the owner of Clarity Health and Wellness Coaching.
And I am Angie McGuire, the owner of Coach Angie. And we are so excited to have Dr. Kendall Lynch with us today to discuss something that is incredibly important to women across the lifespan, but specifically in midlife and what we're faced as we're aging and what's so important. So I think Dr. Lynch I know she did so much preparation for us today. And, we're gonna focus on talking about joint pain and bone density and movement and all that and more. So I think I just want to start out, Dr. Lynch, just asking you, we think this conversation is important to have for our listeners. Why do you think this is important?
Yeah. Well, first off, thank you for having me. I think the largest thing to take away from all of this is that all of us, everyone, just needs to move more and move more often. And then, the nitty-gritties and the specificity of all of that, we'll discuss and digest over the next little bit of time. But I think it's important because as women, fitness and strength and movement and things like more intense exercise is scary. And we don't really know where to start. It's never really encouraged longitudinally. And I think as the generations are moving on, people my age who are entering into perimenopause want a different way. We see some of the frailty that kind of happens with some of our grandparents or grandmothers, or even our parents, and kind of want to make a change. We know we can make a change. And so just any and all information is always good. And any way we can empower people to do more and kind of make a change or think about something differently, I think is immensely powerful and really important. So I can soapbox about all that, but I think at the end of the day, we want more info, but there's so much out there that it's hard to know what is actually credible and what is actually important. Instead of just being a buzz thing. So I just kind of want to offer hopefully some clarity, some research, some science behind these things to get the right information into our hands.
Yeah. That's fantastic because that's actually right where my brain's going whenever I hearing you talk is that you're right. There is so much information out there and everyone's just kind of like be strong, lift heavy, and they're just getting these tidbits, but know why. And I think it's so important to know the why behind it.
Absolutely.
So maybe you can kind of dig in there about, a little bit about, okay, we hear we need to lift and we hear we need to, build bone and do all these things. But why is lifting so important to like the joint health, I guess, joint health and bone density? Why is that such an important piece of it?
Yeah. So the thing, I think you mentioned this on a prior podcast actually, is that inherently estrogen is anti-inflammatory.
Mhm.
Every single cell in our body has estrogen receptors on it. That includes muscle, that includes bone. I'm not going to obviously talk about the cardiovascular, well, to a little bit, but all the other components of it. But really, just from the musculoskeletal perspective, um, that as that's going down, we start to have age-related lean muscle mass loss. So there's a term called sarcopenia that we're trying to avoid in this longer term thing. And so as our muscles start to lose, the muscles move the bones. The muscles also add stress to the bones, which then can weaken the bones because we're not moving or we're afraid to move or anything else like that. So the strength training and focusing on moving differently instead of just walking is enough or body weight is just enough. Adding all this stuff is because then the muscles are pulling on the bones, which helps with something called osteogenesis, the idea of recreating more dense bones across the way. So it's actually just like what the muscles are mechanically doing at the tendon junctions, physiologically at the bones.
Thank you so much for mentioning the power of estrogen because it is
Right?
so important. And I feel like, well, I hope the conversation is gonna change that so people, learn very young about the power of estrogen, right? And
Sure.
they can expect what's going to happen or what is happening in their bodies as we age.
Yeah.
And so, I think many women in midlife have related to this decline in estrogen have complaints of joint pain. And
71% is the most recent
A
data point of that, is that 71% have menopause related symptoms in their bone and their muscles. That's a
it's
lot of
huge.
lot.
Yeah. Yeah. And I also, thinking about, and I know in your practice at Niche and here in Oak Park, and you look at the whole body, and part of like, and which is you would think that about all physical therapists, but there's all, just I wanted to mention that about you because that's one of your, I think, strengths and intentions, right?
Right.
But also you're thinking and evaluating, assessing history. I think because a lot of women come into midlife and they have a history around injury or they've, back, and so we're here, we got to move, but we have this injury. Where do we start? And then we have this joint pain. So I guess
And
where,
fear. And
and fear. Yes, exactly. And that's where and that's why I think it's so important that you talk to your patients about that and take this like extensive history. So I just wanted to give you a
yeah.
big shout out there. But just moving on from that is like, where do women start if they're not moving and they have this joint pain and they're hearing all over social media, everywhere they go, about what we've already mentioned
Yeah.
to
Well,
increase muscle
right. And I
tone
think
density?
historically too, the fight that a lot of PTs are trying to do now, the old adage is you hurt your back, you lay in bed for 3 days. Well, we know that actually just leads to muscle loss.
Right.
Right? If you have the flu, if you've been in the hospital, if you've been in bed, even at home as a young, healthy person, you're still losing muscle mass. Like that just kind of happens. So we're trying to get away from the idea that just because you have joint pain, if you move and it still kind of hurts, you're causing damage. But we know that's not true. Yes, there are outliers to that 100%. But for the most part, that movement exercise is actually the most beneficial thing for joint pain. We just have to kind of follow it within those first like 24, 48 hours, like any kind of muscle soreness type of a
Mm-hmm.
thing. So just because after you do something new, it might have a little bit of some residual stuff over that next day, day and a half, it doesn't necessarily mean that something is wrong. And I think, and that's a hard thing to kind of know what that
Mm-hmm.
teeter, you're kind of on a little bit of a seesaw about how much is too much. And my cue that I use with my patients, at least, is like, if you're, whatever your pain is fluid. You can have a high sense of pain, and that's you, and that's your identifier, and that's great. So just follow whatever that is. My 3 is not going to be anyone else's 3. So I try to tell people, like, if it's up to a 3 out of 10, maybe a 4, your body is starting to be loaded differently. And it's actually giving your brain new information. anything kind of over that, okay, maybe we can have a conversation about modifying or changing what we want to do. And that's just kind of my practice. But the strongest evidence is that we need to exercise and not be scared of it. So, we come back to like, well, where do we start? What do we do with that? And as I said earlier at the beginning, is anything. Try something. Try something that brings you joy, because we know those endorphins and everything else that's happening in the brain is only going to help you do it. If you are so scared to strength train or can't find someone to do it with, well, then go for a walk. Go do something with friends. We know Tai Chi is very helpful for balance and all these other things. So there's so many layers of of joint pain and movement really are. And we know that, yes, strength training is what the evidence shows to really help our bones, but we also know Tai Chi has its own benefits too. So first, find the thing that fills you with some joy. Maybe scientifically, it might not show the best benefits, but we got to start somewhere.
Right.
And I am a firm believer that if we don't enjoy what we're doing, we're likely not going to keep it up.
Mm-hmm.
I mean, we all know that, right? It's not fun
100%.
to just like, buckwheat pancakes 100% of the time, but also, I don't know. I just said that. So, 40 to 60% of women are experiencing this worsening joint pain, like through the menopausal aspect of it. And there's research to talk about omega-3s. Yeah, this is a little outside my scope. I can talk a little bit about nutrition, but I'm just going to mention it because I think they're buzzwords that people really kind of cling to. Omega-3s can help with some of that joint pain stuff. The glucosamine, the chondroitin, a little bit of mixed in research, because when estrogen goes down, we have that increased inflammation, the increased oxidative stress. So we're trying to find anything to kind of get that stress down. Turmeric is one of the things that's actually kind of been most beneficial in research. Curcumin is the active ingredient in that, but you have to take it in a way that's bioavailable in your body. There's so many supplements when we talk about buzzwords and stuff that your body doesn't actually absorb. And you as nurses obviously know the physiological properties of bioavailability. If you take a vitamin D, but you're not adding fat to it, your body can't absorb it. So it's a similar thing with turmeric, is it needs to have some black pepper or some other things. Again, a little bit outside my scope, but if you're going to take something for that joint pain to kind of help you maybe get over the gap of movement, making sure that it actually is working in our body. A little side, little moments about that.
Yeah.
So to get this oxidative stress down, we want to start with kind of the low reps, short bouts of exercise. Sometimes isometric. So an isometric contraction is kind of like you're pushing against something, but nothing's actually moving, right? So a bicep isometric would be me just kind of holding here. So you just kind of hold weights and have just no movement, because it helps provide really good information and proprioception around the joints to make your joints feel a little bit safer and a little bit happier. So if you want to go to the gym, or you want to do something outside of just like walking or Tai Chi, or you want to introduce into strength training, that's a kind of a nice, really safe way, and do like big muscles. Kind of go onto a leg extension machine and lock the thing. So all you're doing is just kicking and holding against it. And it's just low. We don't have to do anything too much to this, but at least starting to kind of wake the body up, because some people probably have never been to the gym ever. And they're hearing a lot of these things. And unfortunately, a lot of personal trainers and people at the gym, A, don't like working with older people sometimes, and B, don't know. They don't understand some of these extra risks or the osteoporotic risks or whatever the case may be. And so where do you start? Where is that starting point, even when you want to do it and you do enjoy it? So it's kind of that start of like, find something you enjoy, but if you want to increase the load, these are some kind of safe ways to start too.
Yeah, and I appreciate that, because I feel like because of what we hear on social media and about the strength, lift heavy and these types of things, people are like, oh, I'm going to go in here, and you hear this, oh, go in and lift 4 reps. Go as heavy as you can to 4 reps. If you would do that day one, you're never going back to the gym, because you're not going to sit on the toilet the next day. You're not going to get out of bed the next day. Like everything's going to hurt. You're not going to be able to do it. So it is about like starting where you are and progressing up, right? Start where you are. It doesn't have to be this, intense workout day one. So that it's super important. And I also want to just kind of add to the, you've said it along, but I want to just kind of tie it together is, you said, estrogen is anti-inflammatory, right? And then you recommended different things that are what? Anti-inflammatory.
Correct.
So we have to replace when we have the loss, we have to combat that loss. And by combating that loss, it can be with your diet, be an anti-inflammatory diet.
Yeah.
Could be super like low-hanging fruit. Get rid of that soda that's inflaming you. Get rid of those seed oils that are inflaming you. These are just, and then tag in some of these supplements that can help out with the anti-inflammatory. And then you might actually be able to feel good enough to go to the gym. And it doesn't have to be every day, right? You
Right.
have to have the rest in there too. So a lot of
Yeah.
important components there. Yeah.
Yeah. Well, and the rest can even also be an active rest. The active rest could just be going for a
Right.
walk the next day. There was there's a whole menopause cohort. I can't think of the right word right now, but like a convention. Like there's menopause specialists that do these big conventions and everything. And there's a whole I do pelvic floor stuff too. So there's a whole pelvic health component of it too. And they had a personal trainer who has done a lot of research on all this stuff. And basically, at the end of the day, the two most important things when we look at all the fitness stuff, like hitting your 10,000 steps and your cardiovascular demands and mobility and balance and strength training, if you can just try to hit closer to your 10,000 steps a day and strength train twice a week, that is enough,
Yeah.
so to speak.
Yeah.
Yes, there's different layers to that, but that's a place to start that doesn't feel so overwhelming because that basic metabolic movement of our 10,000 steps, and that includes gardening, cleaning, cooking, insert domestic task here.
Right.
Maybe that's you park your car a little bit further away or you decide to walk to the library instead of driving, whatever.
Yeah.
It's all
Yeah.
community based too. You're not going to be walking if you live in LA, compared to
Right.
like in New York, right? But that basic movement, allows better blood flow to help get rid of some of that oxidative stress too. So even within this, it's just it's just rest can also be active, I think is maybe what my point
Agreed.
is this,
Yeah,
don't want to
absolutely.
undo either. It's like, oh, I worked out really good this day. And then like the next day, and hey, give ourselves all grace. We can forgive ourselves of just doing the best we can. Because I think at the end
Yep.
of the day, women, there's just so much more overload on us for just insert thing here, and
Yeah,
we can give ourselves a little grace and we can do these things,
right.
with
I
a
think
little
it
grace.
matters about what your goal is too, right? We all have a different
Totally.
vision of what healthy life is. And if your
Totally.
vision is not to, whatever you to have buff arms, well, then maybe you don't have to hit the weights as much. But if your vision is to have strong bones, then you definitely have to incorporate certain things. So it really does, it really is very personal to each person. It doesn't have to be like, oh, I saw this and I have to follow this exact protocol.
Oh, absolutely. And I think that sometimes with the social media stuff that it kind of is like, we also see people at the end, you rarely do we show people being like, here's the struggle of it starting something new. And it's not like a draining struggle, just starting something new is hard,
Yeah.
period.
Yeah.
Yeah.
But we kind of show like, oh, well, look what I can do and look at all this free time I have to strength train. It's like, well, no one's really showing just like the mess of the daily things,
Hmm.
too.
Yeah.
So I think that's just always also something good to put into ourselves of just like, hey, everyone's got to start at some point in time and it all looks different and what's meaningful to you or not. And I think just like a little caveat about that is typically people start exercising because they're gaining weight. And we know that
Yep.
that is part of the process of menopause because of this stuff about the visceral fat that is accumulating in the body. And a lot of that, if we start adding, because our lean muscle mass is going down, we start training muscle mass too, that actually helps to develop some of that visceral fat too. So that old adage of, well, I need to do a lot more cardio, we're actually seeing in the research that like, yes, but actually the strength training helps with some of that body composition.
Yes.
And that's the other focus of some of this. It's not just about weight, but the body composition of your body is more meaningful from a vitality, longevity
Hmm.
type of thing to change the reference inside our bodies too, because so much of it is aesthetic.
Yep.
And it's like, well, maybe it's not about the buff arms, but we know that if I lift weights, whether there's tone or not, it's actually helping some of
Yes.
that other stuff too.
What I was thinking is, as we're listening to all the amazing things you're telling us, though, is that we do have these people that are saying, I do have the joint pain and I can't really get myself started. We do have these people that have plantar fasciitis that they've never had before, or the horrible frozen shoulder that, is having so much havoc on women in this stage of life, and they have no idea why, right? So can you kind of give us just a few things like, for one, if those things start happening, when should we seek treatment? Like, right? Because here is the question of, okay, is this a problem or is this not? And then also, how can we prevent even getting to that spot? Or is there a way?
Yeah. Well, and some of that prevention type of stuff is that, remember the estrogen receptors are everywhere. So the tendons and the ligaments are also going through physiologic changes by losing estrogen. And I think that's what puts a little bit more of that stress, plantar fascia, connective tissue, the shoulder. Why those specific areas? Why is the shoulder the one that goes? I don't know that they know it, right? And the thing about it is it takes 9 months to 3 years to recover from frozen shoulder. Like that's what the research kind of shows. Sometimes whether you've had PT or not, which is hard as a physical therapist to say, but that is true. That is just what it is. That you just kind of have to go through this kind of cycle. And that's not great to just admit that we all just kind of have to go through that. Because the old adage was, it was like, oh, if you're more diabetic or you had trauma, that's why we developed it. But is there something else kind of going on? But there is just an increased risk of injuries to those tendons, the ligaments, because of the stiffness. It becomes more kind of rigid and stiff across the board. So low level movement, kind of like, think like moving kind of more fluidly, like a Tai Chi in the pool, in the water. It's hard to know for sure because what are the actual risk factors and the indicators for each individual person? I don't know if they have the research for it because they don't do the research on the women. We just know it's happening. But like, oh, does this person have this marker, this marker? I don't know that we know that. And right. I don't know that that data is 100% there, but we are seeing it more frequently across the board. There, and the other aspect of this is what is also happening in midlife. If you have children, it's chaos over here. Yeah. It's also over here. And so if you were a very active person and then you stopped and menopause is kind of taking you down a notch, general movements and just getting dressed all of a sudden feel like a task for your body. So I think from like the idea of supplements, and I say that in quotes only because there are really good ones and there are not, mostly are not very good. But are there things that just to kind of keep as fluid as we possibly can? Is that just, oh, we need to optimize more water? Is it looking at the omega-3s in that kind of, even though it's not joint pain, but the inflammatory markers are up. So could we look at it kind of back into that standpoint? Maybe there's just not good information about how to combat it or do all this preventative stuff. Cause sometimes these things just happen even in the best, you see people who have been strength training for 40 years, right? And they develop it. Well, what is kind of going on there? And I don't, I wish I had a better answer, a better thought for what it is. But I think your other question too is like, well, what do we do about it? Okay. So let's say it does exist. Obviously as a PT, I'd be like, well, you should just go to PT.
Yeah.
But I think all jokes aside about that is I think across the board that people don't know that you can, for the most part, except with Medicare, you can see a PT without a prescription. You don't need to go and see a doctor to see a physical therapist. We all have a doctor at this point in time. In the state of Illinois, you can see a PT without a doctor's prescription for up to 15 days or 10 visits, whichever comes first. Usually it's going to be those 3 weeks that'll come first. And so at least to kind of start getting the ball rolling about what's happening within our body and start giving you ideas instead of like, well, let me go see the doctor. And the doctor just told me to put some orthotics on. Yeah. Well, what we know is that the tissues are weaker, they're stiffer. What is an orthotic going to do except maybe put a Band-Aid? But if your feet are still weak or you're not loading through the whole chain well, then how is that going to like long-term that? And at the end of the day, the physical therapists are the movement experts. We are the ones who watch movement and evaluate the intricacies of what's happening in the body and how up the chain is affecting down the chain and down the chain is affecting up the chain. And if you've asked and asked about prior history, then we know, well, oh, you sprained your ankle or you were in a boot 25 years ago. That's the foot that hurts. Well, I wonder if there's been this accumulation thing that you just didn't realize was happening. So I think the thing is anything is getting sooner, even if it feels silly, sooner the treatment, sooner the better approach to it. Because so many of us will be like, oh, it just kind of hurts. I mean, I do that. Oh, my shoulder kind of hurts, or oh, my knee kind of hurts. I'm sure it'll get better,
Yeah.
which it might. But also, if you can just like low access, go see someone who can check it, well, then that's great.
Yeah. And I think that all depends on your history.
Not all PTs are made equal, and not all nurses are made,
That's true.
Time is of the essence, I suppose. Sorry,
Yeah.
I interrupted.
No. I just think, and then based on your history too, whether we ignore things or we don't, where you come from, like whether you're an athlete or not, and if you're used to like having different like niggles and like pain here and there, you're used to it. And you just think you should move on and like suck it up. And as a woman, we tend to suck it up because of lack of time and that we're taking care of everything else.
Well,
but thank you so much.
Sucking it up distracts the brain enough to like actually inhibit some of that pain, so we're not hyper focused on it. So there's also kind of the pain science behind it too, which like sometimes we get too focused on the stuff and then it becomes a bigger issue.
Right.
So a little rock in a hard place.
But that's when we need professionals, right, in our lives to help us understand and decrease that stress. Right? The more knowledge is power. Absolutely. And I thank you so much for saying, about that we can come to you. We can come to a physical in Illinois. I don't know what it is in Missouri, but without a doctor's note. Doctor's order. I don't think most people know that. And I do remember when I saw you speak last year, and you said, like, why doesn't everyone have a PT, assessment annually, just like we have other annual assessments? And that was my greatest takeaway from that. And so I'm so happy that you touched on that. And I'm going to put that, that's going to be on my list for all my clients. Have you had your mammogram? Okay. Have you been to a physical therapist? Okay. Well, regardless if you have pain, injury, swelling, I just think it's so important.
Right. And like our body, because of those histories of ignoring pain or having pain, or I was an athlete or I wasn't an athlete and I don't, not everything is an alarm bell. And we also, our body kind of lies to us. It'll compensate for those things unknowingly. And no one is perfect. No one is exactly symmetrical across the board from a movement perspective, because everyone's either left-handed or right-handed. And even if you're ambidextrous, you still, will default to one side a little bit more. And that creates unevenness. And so if we know how our body will kind of default into unevenness, for example, I sit into my right hip all the time. I collapse to the right. That's my deficiency that someone told me about 4 years ago. And I'm a physical therapist. I was not aware that I was just ever so slightly cocked to one side, for lack of a better word. And so now I know that information. And so when I watch myself in a mirror and I'm lifting, or if I'm doing squats or even on the Peloton, making sure that I can feel that I'm finding that evenness, it feels crooked. I feel crooked now because my brain thinks that I'm skewed to the other side. So that empowerment of information is kind of really what I think, and it's not a common conversation about having an annual PT exam. It's one of my future goals. But it's just that information of like, hey, you feel off because your body has been living a little off. And the last thing you want to do, especially when we have joint pain, is further reinforce the fact that you're a little off. And alignment is fluid. We kind of get into this thing like posture is very much like it must be perfect. But it's kind of more like a cone of safe. We want to have a safe area to come back to that's still a little malleable, but we need to know what that is. And a lot of people's cone of safe is a little skewed to one side. So when they go to do things, they're actually reinforcing potentially some of that joint pain or potentially some of that other stuff unknowingly that their body is compensating for. But how do we know that? And you only know that if you watch yourself in a mirror or someone tells you. And like I said, I do this for a living and I was not aware of my own offness, we'll say.
Yeah. That's fantastic. I was actually just thinking that one day we were doing an interview, and noticed I was like this. I was like, oh damn, got to straighten that out. I mean, like you don't even realize. And like you said, now you're on camera. A lot of us are on camera more, so you
Right.
can kind of catch those things. I also find that like if you go to Pilates or if you go to yoga, they'll catch a lot of the things because they'll be, coming and adjusting you, and you're like, wait, I thought I was straight. It's like, no, no, you're not straight. Let me just shift you just slightly. So it is
Yeah.
kind of that kind of brain body connection that we need to put back. So, as you were saying, all movement is good. You can find a lot about yourself whenever you start going and doing things that are a brain body connection, like yoga, like Pilates, like Tai Chi.
Right. And those are the things. But when we talk about strength training and how important it is for all these other benefits, that brain body doesn't really happen in a gym in the way, like with a personal trainer or the people who work at the gym. They're not really, that's not part of their training.
Yeah.
Also, across all fitness, there's no standardization of education. There are higher levels of standardization. So you look at like the ACSM and the NCSA, which is like the National Strength and Conditioning. They require people to take a test to actually have a baseline information. But if someone was just trained at, I'm going to use the YMCA, I don't know, but like someone was just trained at the YMCA to become a personal trainer, there's no standardization there. And I'm not throwing YMCA, they might, I don't know. Right. But that's a tough thing too, to be like, well, how am I going to trust this? But as a PT, it's like, well, if we can get more information into personal trainers and get more information out into those people, because that's the first line of access.
Yeah.
So yes, I want people to come to PTs, and yes, we want them to be seen here, but most people are just going to go to those places. And yoga and Pilates tend to have a little bit more support or a little bit more conversation about checking in with what's happening in your system. But when we talk about the strength and conditioning environment, that's not really their focus.
Yeah.
Which is just getting more information out there, right? Like that's all we can do.
Yeah. And it's funny because as you're saying that, like we talk, Angie and I talk often in other podcasts about the fact that, providers are not trained in menopause, right? They don't, they're not trained. And so we say, right. And we say all the time, if you go to your provider and you are not getting the help that you need to find a new provider. Same thing with your personal trainer. Same thing, like if you are going in and you are getting resistance against the way that you want to train or, don't feel right. Absolutely. Like we're so conditioned to just be like, okay, I'll just do whatever you say. And it's like, no, no, no. Like you can say no and you can find someone else.
Especially as women.
Yes, very much so.
We're very much like, okay, this is probably not, I'm just not going to say anything. I mean, I do it. Absolutely. Yeah. That empowerment of just like, hey, you can find someone else. That is good. That is important. Yes.
Yeah. I mean, Jen and I talk about that a lot, just around our menopause medicine, and is advocating for ourselves and knowing what we know and knowing our bodies the best. And we need to step up and communicate that of what we want. Not that we know it all, because we don't. We're going to the professional, our medical providers for, collaboration and in a conversation. That's what we should get.
Yeah. But as a PT, I mean, I tell my patients, I'm like, your body better than anyone else. Yeah. I'm not going to tell you what I think is going on. And also, your own symptoms. So let's have this collaboration. Like you said, I mean, it has to be like that.
Yeah. One thing I wanted to ask is how do you work with your patients or friends, family about getting away from this mindset about going to the physical therapist when we're injured or we're in pain? Or like, how do we, think about preventative physical therapy? I know we've already touched about this a little bit, so I don't want to belabor it, but I do think it's a mindset that we reach out. Maybe we do that in all areas of healthcare. Maybe that's just because we're human in time. And I just think it's an interesting conversation. Like, how do we, seek preventative care for our head to toe, skeletal, musculoskeletal system?
I just think it's not a conversation, right? All of our healthcare system, for the most part, is reactive. Yeah. Right? Yes, you go to you should have an annual mammogram. Like, I think as women, we're like, oh, we get our mammograms, but we don't like go to the doctor for regular blood work. We don't go just like keep up that prevention. It's like, oh, I think something's amiss. Now I should go. But I think that's just kind of how it's been ingrained. Yeah. Across the board. Yes, it's time too, but I think it's very much like, well, I'm not hurt. Why would I go? Fair. Absolutely fair. And so again, it's just I think it's raising the awareness too that PTs are more than just that, or PTs are more than just an extension of the doctor.
Mhm.
I just moved from the East Coast, and there was a little bit more push of people on the East Coast, I feel like, compared to the Midwest, who are like, oh, PTs are their own entity. I felt it more there than I felt it here, where it's like, well, my doctor told me to tell you as a PT, you need to do X, Y, and Z. Maybe true, but they saw you for 3 minutes. Did they watch you walk? I don't know. I don't know. So I think it's just like an ongoing advocacy too, from a PT perspective, and what our national organization should be, in my opinion, doing a little bit more of. But it's hard because they're up against all the insurance and their reimbursement and people wanting to use their insurance, going and doing an annual PT exam. I don't know that the insurance companies will cover. I don't know. I mean, we could call it an evaluation and write it in as that, but like this idea of kind of coming and going like you would a massage therapist or even a chiropractor, it's not the same thing that you kind of get from physical therapists. But that's how I've spent the last like 10 years of my career, because I was on the East Coast, part of it. When I moved to the Midwest, it was definitely a little bit of it was just different. It was just kind of like, hey, you can things can be done differently from a PT perspective. And people are like, oh, weird. And I'm still using my insurance benefits, and I'm getting a little bit more one-on-one care. So I don't know, advocacy across the
Advocacy,
board, right?
education. Yeah.
Education, word
Amen.
of mouth.
Yeah.
I think
Yeah.
people start to feel it and experience it, and then that becomes a larger conversation. I think that's some of the benefit of social media, is you can start having more conversations about what works and what doesn't. I think that is one of those benefits. I am not great about social media, but it is a good avenue to actually spread information, hopefully the right information.
When it's good information.
Right.
Right.
So just in wrapping this up, I have to ask you about your shirt because I love it.
Yeah.
So I mean, I definitely from this conversation understand the be strong, and I feel like it's a very empowering conversation. Tell me a little bit about the be different.
I think it's just thinking about life differently. I kind of mentioned about how I, as a PT, do things differently than I think conventional PTs, I'm going to say, or corporate PTs, let's say that, which is kind of where a lot of the orthopedists will they're like, oh, just go to this place. And then they see a therapist for 20 minutes, maybe, and then they're with an aide the rest of the time. And so it's the idea that there are different ways of doing things. And also within our body, we all have our grooves. Mine is like this,
Mhm.
And I think we get like, oh, our posture or our movement needs to be perfect. No, it just needs to be different than what the normal is, so that your body starts to learn different load and different stress. So there's a difference of like treatment and care. And then there's this idea that your body doesn't need one way of doing things. It needs different ways of doing the same task, so that you don't wear your joints down in one way, or you don't reinforce the same thing over and over and over again. Because there's optimal ways, but sometimes people can't find optimal. So how can they just move differently that's going to help optimize the overarching movement across the board? And something that I didn't really touch on, and just kind of back to the strengthening thing, just real quick, that we need more multi-directional movement across the board. I think we kind of we talk about weighted vests. All right, let's talk about weighted vests from a menopause region. The point of weighted vests is it adds more load to your spine, right? But if you actually look at the research, you need 2 times your body weight to actually allow for osteogenesis, or you need more weight a lot. So if you're going to wear a weighted vest, great. But doing that for 20-minute walk might not be enough. You might need to wear a weighted vest and have intervals. So you walk a little bit and then you jog, and then you walk a little bit and you jog. So it is adding more and more kind of moments of impact for a longer period of time. So it does kind of help in that way. But really, your body starts to adapt. So if this is your exercise all the time, love it that you're outside and you're getting your steps in with your weighted vest, but your body adapts, and then it will not make more bone.
Interesting.
Or it'll kind of cap out. So yes, and doing more different movements where you're adding different stuff, adding rotation if it's safe. Okay. There's always outliers for osteoporosis and everything else. But if it's safe, the multi-directional movement is key. You have to add variety. You have to add different. The idea is that strength training is important, but it has to be progressive. So you can't just be like, well, I'm going to stay at 50 pounds forever. No. And I think that's kind of one of those things that happens with like curves or some of those other fitness stuff is it just kind of keeps everything kind of in this like, yes, you're doing the things, but it's not enough. Yeah. So it's like weighted vests are okay, and it's not enough. So back to my shirt. There you go.
Yeah.
Well said. Well, Dr. Lynch, can you tell us, tell our audience where we can find you? You said you're not great at social, but I'm sure you have some on social.
I got goals. I got goals.
We all do.
You know? Yeah. So so my business name is Niche Physical Therapy. I'm based here in Oak Park, Illinois. I'm on Instagram as Niche Physical Therapy. Pretty niche, spelled Niche. I think sometimes people added other letters in. And my website is the same, www.nichephysicaltherapy.com. My email's on there. Like I said, the empowerment, if you ever have any questions, send me an email. My email's on my website. I just think, again, if we can expel it, that only helps people out. We're not trying to gatekeep that information.
That's awesome.
Thank you.
Yeah, I definitely feel empowered, Angie. What about you?
Oh, me too. Absolutely.
Now let's go be different. I can't wait to change something up in my exercise. I'm going to do something different.
Yeah, that's right. Well, I'm so happy to, share anything and all the things all the time because it's just great. I think it's just great.
I appreciate it. Well, thank you again, Dr. Lynch. Thank you so much for your time. If you enjoyed this episode, please make sure you give it a like, add some comments at the bottom, and please, as always, subscribe so that we can bring you more amazing experts and share the wealth of knowledge that they have. Thank you and have a great day.